Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
What is hypercalcimic crisis? In hypercalcimic crisis, actually a patient with primary hyperparathyroidism, they will present with the following conditions. If the patient presents with acutely with nausea, if the patient presents acutely with either nausea, vomiting, fatigue, muscle weakness, and if the patient also presents with confusion and decreased level of consciousness, all these are because of increased calcium. So this is called as hypercalcimic crisis. So a patient following the primary hyperparathyroidism, if the patient presents acutely with nausea, vomiting, fatigue, muscle weakness, confusion, and decreased level of consciousness, then we call it as hypercalcimic crisis. In this condition, actually the calcium levels were found to be elevated. They are almost in these conditions, the calcium levels were found to be elevated to almost 16 to 20 milligram per deciliter, and parathyroid hormones will either be large and they are multiple. The parathyroid glands will be large and multiple, and the tumor may be palpable in these conditions. Next, a patient with parathyroid cancer or familial hyperparathyroidism might present with hypercalcimic crisis. So, it is seen in patients with parathyroid cancer or familial hyperparathyroidism. Now, how are you going to treat this hypercalcemic crisis? This hypercalcemic crisis is mainly treated by the main therapy is to reduce the serum calcium levels. We should do the therapy or treatment to reduce the serum calcium levels, followed by surgery in order to correct the hyperparathyroidism. So the main treatment is you should correct the calcium levels. So calcium levels are corrected by giving the rehydration of the patient with 0.1% normal saline and along with diuresis in with furosemide. So if you use furosemide for diuresis, furosemide causes excretion of calcium, so thus it lowers the calcium level in the blood. Okay, so this is the mainstay of therapy. We also have other drugs. We can also use other drugs which decrease the calcium levels. The other drugs which decrease the calcium levels include we have bisphosphonates can be used to decrease the calcium levels with calcitonin. Mithramycin can be used, gallium nitrate can be used along with the glucocorticoids are the drugs which can be used for the lowering the calcium levels. So these are the other drugs which are used in hypercalcemic crisis for lowering the calcium levels.
thank you and thank you for watching.